Afrin Sinus, Oxymetazoline, 0.05% nasal spray is used to temporarily relieve congestion in the nose caused by the common cold, sinusitis, hay fever, and allergies. It works by narrowing the blood vessels in the nose area, reducing swelling and congestion. It is important to follow the recommended dosage and use this nasal spray as directed by your healthcare provider. It is best to use this nasal spray at the first sign of congestion, and not to exceed the recommended dosage. When using Afrin Sinus, Oxymetazoline, 0.05% nasal spray, it's important to follow the directions provided. Before using the spray, gently blow your nose. Then, close one nostril and spray the medication into the open nostril as you breathe in through your nose. Repeat this process for the other nostril if needed. It's important to avoid spraying the medication into your eyes or onto the middle of the inside of your nose. After each use, be sure to rinse the spray tip with hot water or wipe it with a clean tissue and replace the cap. Remember, this medication provides only temporary relief. It's crucial not to use it more frequently, use more sprays, or use it for longer than directed, as doing so may increase the risk of side effects. Using this medication for more than 3 days may also cause rebound congestion, which can lead to long-term redness and swelling inside the nose, as well as an increased runny nose. If this occurs, stop using the medication and consult your doctor or pharmacist. If your condition worsens or lasts after 3 days, be sure to inform your doctor. And that's how you use Afrin Sinus, Oxymetazoline, 0.05% nasal spray. Some temporary side effects of Afrin Sinus, Oxymetazoline, 0.05% nasal spray may include burning, stinging, dryness in the nose, runny nose, and sneezing. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication, they have determined that the benefit to you outweighs the risk of potential side effects. Most people using this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience any serious side effects such as changes in heartbeat, dizziness, nausea, headache, mood changes, trouble sleeping, shaking, unusual sweating, or weakness. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so if you notice any other effects, it's important to consult your doctor or pharmacist. As for the best time to take Afrin Sinus, Oxymetazoline, 0.05% nasal spray, the recommended dosage for adults and children over 6 years old is 2 to 3 sprays in each nostril every 10 to 12 hours. It's important to follow the dosage instructions provided by your doctor or on the packaging. Always consult your doctor before using this medication in children under 6 years old. Before using Afrin Sinus, Oxymetazoline, 0.05% nasal spray, it's important to let your doctor or pharmacist know if you have any allergies, especially to sympathomimetics like pseudoephedrine. This nasal spray may also contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. If you have certain health conditions such as heart or blood vessel disease, overactive thyroid, diabetes, high blood pressure, or difficulty urinating due to an enlarged prostate, it's important to consult your doctor or pharmacist before using this product. It's also essential to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. Children may be more sensitive to the side effects of this nasal spray, so it's recommended to check the product package or consult with your doctor or pharmacist to see if it can be used by children. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also unclear whether this drug passes into breast milk, so it's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using Afrin Sinus, Oxymetazoline, 0.05% nasal spray. Certain medications may change how Afrin Sinus works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's crucial to avoid taking MAO inhibitors, such as isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzine, procarbazine, razagiline, sulfinamide, selegiline, tranylcypromine, while using Afrin Sinus, as it may cause a serious and possibly fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before using Afrin Sinus. If you have any questions about when to start or stop taking this medication, be sure to consult your doctor. If you or someone else has taken too much Afrin Sinus, Oxymetazoline, 0.05% nasal spray and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include drowsiness, slow heartbeat, dizziness, and fainting. It's crucial to take the recommended dosage and not exceed it to avoid these serious effects. It's important to remember that you should not share this medication with others, as using the same container with more than one person may spread infection. When it comes to choosing a nasal decongestant, there are many options available over the counter. It's best to consult with your doctor or pharmacist to determine which product is most suitable for your needs. Next, let's talk about Afrin Sinus nasal spray. This medication is used to relieve nasal congestion caused by colds, allergies, and hay fever. It works by narrowing the blood vessels in the nasal passages, which reduces swelling and congestion. To use Afrin Sinus nasal spray, simply spray it into each nostril as directed by your doctor, usually 2 to 3 times a day. It's important to not exceed the recommended dosage, as overuse can actually worsen congestion. It's best to use this medication at the first sign of congestion, and it should only be used for a short period of time, usually no more than 3 days. If your symptoms persist, it's important to consult your doctor. Make sure to check the storage instructions on the package and keep the medication away from heat and light. Be sure to store it out of reach of children and pets. When the medication is expired or no longer needed, make sure to dispose of it properly. It's important to consult your pharmacist or local waste disposal company for guidance on how to do so. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.